If you're joining a little late, there is a Q&A section where you can type in the questions. Marianne will be watching that. So just feel free to throw those questions in there when you have them. So I'll go ahead and get started with our first question. So today we're going to be talking about people who are returning home from prison. And so this first question is kind of, the very first thing that happens, returning home. So want to ask you both, Evan and Darrell, what are the challenges that you often see people facing when they are returning home from incarceration?
Darrell, I think you should lead on this one.
Darrell, can you hear us, Darrell?
Well, I see his thing. I can start, but maybe while Darrell reboots or gets his.
Yeah, and Evan, would you like to introduce yourself as well while we're thinking about that?
Yep. So again, thank you guys so much for putting this together. So I'm Evan Ashkin. I'm a family physician based out of UNC. I work mostly in federally qualified health centers like with Piedmont Health Services, and I'm the director of the North Carolina Formerly Incarcerated Transition Program. And Darrell is one of our community health workers. Our program is based on really trying to let the voice of the people impacted by incarceration lead our efforts. And all of our community health workers are themselves formerly incarcerated. And the role in the FIT program is for the community health worker to pretty much have like a comprehensive reentry plan for folks who are coming out of incarceration. So housing and employment, food, family reunification. But one of the big missing pieces has been connections to essential health services. And that's the difference with the FIT program, is that Darrell is very much embedded, as in all of our community health workers around the state, in a medical home, federally qualified health center. So in Durham, that would be at the Lincoln Community Health Center. And we have we're in 6 counties in the state. I'm the provider in Orange County as well as run the program. Looks like Darrell may be trying to rejoin. But so the initial, I'll speak while Darrell Darrell is the front line of this work. So I do see a lot of people immediately upon release providing clinical services. And, I would probably say the list, sadly, is housing. So, a safe place to live is a really important, essential need. That's probably really obvious to everybody here. But it is very challenging when you come out of incarcerated settings, especially if you've been in prison, you probably don't have anywhere to go to. And you might have issues with family reunification. So that's a huge challenge. And then for people coming out of jail too, a lot of times with chaos in their lives of being involved in the criminal legal system creates housing is often very insecure and a big struggle. So housing, very important, employment, and a lot of times people have unmet health needs, which may actually have led to their incarceration. So you may all be aware, almost half the people probably in our jails or prisons are there for the crime of mental illness or substance use disorder. Instead of getting treatment, they're being incarcerated. So that is a very important need to get people out of this cycle of incarceration, but not necessarily day one, the most urgent need. Darrell, if you're able to talk now, that would be awesome.
Yeah, I apologize. I dropped out just before Casimir asked the question. Sounds like you were answering really well. It took me a while with technical difficulties. I don't know why. I'm having so much trouble, but I am here now. If you don't mind.
We all have those days. We all have them.
Yeah. It's one of those days, but hey, we're gonna get through it. Casimir, do you mind repeating the question?
Of course, we're going to blame it on the rain, Darrell.
Thank you.
So the question was, what are the challenges people face when they're returning home?
It sounds like Dr. Ashkin hit on that from my perspective, and I'm the community health worker in Durham County Public Health with the FIT program. We started the FIT program, the first site rather, Durham County Public Health. And from what I see, having stable housing is one of the top priorities. But what the focus of the FIT program is helping those with chronic illness get connected to a primary care provider, as well as helping with prescription meds. So whether they're a substance use disorder, a mental health concern, or just chronic illness like asthma, high blood pressure, diabetes, if you're not well, you don't treat your chronic illness, then those other things won't be possible anyway. So our main focus is treating people with chronic illness so that they can take that off of their plate and deal with the other things. I heard also Dr. Ashkin talk about how people are being incarcerated, mass incarcerated, with drug charges and mental health concerns. And the stigma on mental health is not just out here in the free world. The stigma on mental health runs rampant inside of the prison walls as well. Not really understanding, having education about mental health, not understanding that anxiety, depression, PTSD, when you read the definition of these things, a lot of people are undiagnosed. And rather than treat that, they get incarcerated. And they usually start using substances to self-medicate. So to sum it all up, I think the main thing when folks come home is getting a primary care doctor if they have a chronic illness or opioid disorder and address that, or mental health, and definitely housing. Finding adequate housing has been the thing. People are finding places, but they're not conducive to a person re-entering just because of the environment.
Yeah, definitely. And it sounds like there's an array of challenges, and they all kind of go hand in hand when you think about it. And so to kind of segue into the next question, what kind of programs and policies are in place to support these people who are returning home and also to support their families during this time?
I'll talk about the programs. Durham is very rich with reentry programs. We have the local reentry council. Just about everybody that returns comes through the local reentry council. And from there, all the community partners are at the table, like Step Up Durham, like NC Fit. The Welcome Home program is a really great program. It was created by the city of Durham a few years ago, where they give a person coming home a box, a welcome home box, a letter from the mayor welcoming them back to the city, which is great. That's very personal. A cell phone, everybody needs a cell phone, cosmetic items. So that's a very, very good program addressing people coming home immediately. And like I said, just in Durham County, we have a lot of different resources. Some of the rural counties, not so much. We're working to expand our FIT program and FIT Connect to try to address some of those. But those returning to this county or the county of Durham and Orange, and we kind of are rich with resources.
I would just add, I'm not sure where the participants are in this call, but as Darrell said, Durham may be one of the most aggressive communities in really leaning into support, and that many communities almost have very, very few. They're really just people who are doing this work out of their own personal mission to be of service and may or may not be getting support. And so depending on where you are in the state, if there is a local reentry council, that's like a thing which the Department of Corrections supported communities with grant money to create these local reentry councils and hiring coordinators. So they would get the people who were actually doing the work on the ground together in the room so they could collaborate together and really hopefully be able to provide the array of services. NC Works is available and actually I think in every county to some degree to help people with employment. It's, I think, more and less effective depending where they go. There are second chance employers in the state, which are, it's good that they're second chance employers. On the other hand, a number of those employers take advantage of people who are coming out because they have such difficulty because of the incredible amount of discrimination they face in employment. So yes, it is a job, but on the other hand, usually low wage, no benefits, and then people feel oftentimes that they can't complain or advocate for themselves because they're in such a vulnerable position. So that's difficult. North Carolina Disability Rights is another organization that can help people coming out of incarceration if they have disability and are being discriminated against. The housing, every county now is supposed to have sort of a entry point for housing resources. So it's important to know what that entry point is in your community to help folks. Those are some of the main programs out there, but sadly, there are very few sort of comprehensive reentry programs around the state.
Yeah, so it sounds like there's a lot of support here in at least the Durham area for people when they come home and their families, where they can go and hopefully get resources to help the transition be a little bit more smoother. And so what does the data tell us about their experience for Durham County when they're returning home? Are all of these programs beneficial? Are we noticing that there is a gap? I know you all focus on, mental health. So what have you all seen in your realm as far as people's experiences when they're coming home? Is your program benefiting them? Can you all speak on that?
Darrell, I can take the first stab at what we collect. So one thing I have to say, Kashmir, is that we have so under evaluated reentry and health in these programs. There's actually really scarce data across the country when you look at evaluation of reentry programs. So I'm not just making an excuse. It's just a part of the reality of how invisible this issue is for a lot of people in society. One bracing statistic, if you look at the National Institute of Health, which is the public dollars that funds medical research, less than 0.1% of their budget over a 5-year period of time was spent on looking at anything related to incarceration and health. So oftentimes we don't have great data, but I can tell you that our program is based on a model called the Transitions Clinic Network. And they have been very diligent about actually trying to study whether what we do works. And we are part actually of a national organization that is in 14 states, Puerto Rico, and supports about 45 clinics. And I'm proud to say that 8 of those clinics are in North Carolina. So we do have a system for evaluating whether being part of FIT is helpful. And the good answer is, the happy answer is yes. And actually, people who are in our programs have a 50% reduction in using emergency room, over 50% reduction in hospitalizations that could be prevented if they had a primary care provider. We've shown that people are less likely to be incarcerated. As a matter of fact, a 45% reduction in days incarcerated in the first 12 months, fewer parole and probation violations, and have actually even recently published showing that for every dollar you invest in a program like FIT, you save about $2.50 on the other end. So we have hard data, and then anecdotally, I would like actually Darrell, because again, he's on the front lines working directly with clients, to maybe talk about what he sees in his day-to-day work on the impact of being in the FIT program.
Thank you, Evan. Casimir, that was a great question. And for a person like myself that's on the front line and doing the work, I have this passion and this drive to save the world, right? Save everybody, or help, I should say everybody, not save them, but help them, right? And that's just not realistic. That's unfortunate, it's not realistic, but I realize that we are trailblazers in piloting something that really, really works. I have so many success stories compared to failures. It's gonna happen, but the success stories of people getting connected to reentry resources, getting connected back to their families, having success, seeing me in the community and, giving me credit for it, although I can't take the credit, they did it themselves. But just being able to empower folks to come home. The unique part about the program that we do, the TCM model, and Evan created NC Fit here in North Carolina, is the CHWs are formerly incarcerated. So I'm formerly incarcerated myself. Those closest to the problems are usually closest to some solutions. Being that I have lived experience of reentry and incarceration myself, I understand from a different perspective. I've walked in those persons' shoes. And so I'm able to show empathy from a different level. And that's the unique part about our program. I would say it's working. It's definitely working. We want to reach so many more people, and folks do fall through the cracks, but I've reached at least 350 to 400 individuals myself personally in the last 4.5 years. So our program works. We have the data to prove it works. And we just want to keep building and keep growing. And again, touch and impact as many lives, returning, and families as we can.
That is amazing. Seems like, you all are making a great impact. And as far as data goes, there is progress being made. There is help being done. And so that is good to hear. I always like to hear it working in a reentry type of organization myself. So looking specifically at Durham, how does all this fit into the bigger picture of policies and work that is being done in our city now?
Let me talk a little bit about healthcare financing for a minute, because this has been a huge barrier in states like ours that did not expand Medicaid. So I think, as we're probably all aware, when they wrote the Affordable Care Act, they assumed every state would expand Medicaid. So if you were below 125% of the federal poverty limit, you were not eligible for the subsidies in the Affordable Care Act, because the assumption was that you would be on Medicaid. And sadly, in our state, that has not been the case, and we'll see what happens in the future. But so one huge challenge was, we knew our clients were not going to be able to afford their healthcare, even at a place like Lincoln, which does a great job with a sliding scale fee. It's still unaffordable. You don't have the $25 for that one visit, and then if you need medications, that's a whole nother issue. So actually, we have spent a lot of time raising funds for our clients to be able to get care. So if you're in the FIT program, you actually have your sliding scale fee covered, and up to $100 for medications per month. And then we do try to get people on Affordable Care Act insurance if we can. So that's been it's really one important thing I wanted to point out. And then your question about policy in Durham, I think one of this has been a very important push recently, is this push for permanent supportive housing in Durham, which many of you may be aware of. And that when I say permanent supportive housing, that's like a thing, right? That's an actual intervention. It's been shown to be very beneficial for people with mental illness, where you have housing that actually is permanent and also has wraparound services available to support people. And there's actually a movement right now to use some of the opioid settlement dollars and other funds that the city has to obtain some more permanent supportive housing, which our experience, as Darrell mentioned and I started off with, this is the key for an enormous number of people. I think it's probably maybe even 50% of our clients. If we cannot come up with reasonable housing solutions, eventually the wheels come off. And this is, I think, very true with our folks who have serious mental illness like schizophrenia or, severe depression, bipolar. And then, there are cities which are working toward expungement. Durham has been great about having events where they try to waive fees, because, a lot of people, when they get out, they can't get their driver's license back. And without a driver's license and a car, how are you supposed to have a job, and so on? And many, many counties have these very punitive fines, and they don't relieve them of them. But Durham has actually done a great job in trying to help reduce some of those fines so that people can get their license back. There's also been bailout days maybe you guys have heard of these, where there are people Again, another way we punish people of low socioeconomic status is through cash bail. So people are spending all this time in jail, again, taking further damage to their financial situation by not being able to get out because they can't afford bail. And Durham has been actually quite progressive and with some great organizations doing those quote unquote bailout days. Darrell, do you want to add more to what you've seen in advocacy in Durham?
Yeah, excuse me. Along the lines of the same things you said, as far as the funding, what I would actually like to see, Kashmir, is programs like the one you work in, programs like the one I work in, have a little more collaboration as far as putting together proposals to change policy. So we can advocate, but we're stronger in numbers, right? We're the ones who see how people are falling through the gaps. We see what's happening. If housing is the issue, then we all get on board to push policy so that some of these buildings that are abandoned, some of these places that aren't being used right now, to be able to turn those into, living spaces for those returning, especially those with mental illness, as Dr. Ashkin mentioned. Because without adequate housing, we do all that we can do. Step Up does all they can do. And it's just inevitable that the wheels fall off if they're not in a stable place. And so we see that that's one of the biggest hurdles. And I just think in advocating solo, they hear me. But if we can collaborate and move in numbers and push policy for change, that's what I would like to see.
Yes, I agree 100% on that. There's power in numbers, and working together, we can always conquer more. And so thank you both for answering that. We did have a question pop up in the Q&A that I'm gonna answer live right now. It's they asked, where can we find statistics on chronic health issues that cause disabilities while a person is incarcerated, such as diabetes, stroke, heart attack, and what, if any, programs are available to address this once released?
Yeah, the data on chronic conditions is not great. So the Bureau of Justice Statistics, so BJS, I think it's bjs.gov is their website. They have statistics on chronic health conditions for people in prisons in the US. However, that data is self-reported. So it's not the best, right? Because if you come from a disadvantaged community, you may have not had healthcare services and know what your chronic conditions are. However, but that actually data is some of the data that does drive a lot of policy in the US. So bjs.gov, and then I will pitch. Dave Rosen and I actually did a study in the North Carolina Medical Journal. So we were interested for our state, how many people have what chronic medical conditions? And unfortunately, our prison system's electronic health record, it's not, you can't do a query and just say, okay, how many people have high blood pressure? Or how many people have diabetes? Because we really wanted to know the answer to your question. So what we had to do was actually, we got a list of all the meds that they prescribed to people upon release from incarceration, and then very tediously went through that list and tried to figure out what disease they had. Now, this sounds ridiculous, and it sort of is, but that's the level we have to be functioning at. So, it was sort of easy with diabetes because, if I saw meds related to diabetes, that was obvious, but it was not like high blood pressure meds. You could be on certain cardiac meds, and it would be hard to know whether that was because maybe they had a heart attack or congestive heart failure or just high blood pressure. So not great data. And the same holds true for the mental illness statistics. But so bjs.gov, and then this article, if you actually Google my name in the North Carolina Medical Journal, you can see that data on what we saw in North Carolina. But, the jail health data, we really want to know about what's also going on in our jails, because as you know, every county has a jail. There's very poor reporting. This is not just in North Carolina, but around the country. So we have really limited understanding of what is the health status of people in our jails, and also what do they get, right? Because there is a constitutional right to healthcare from the 1976 Estelle versus Gamble decision, but there's no real standard that has to be lived up to. So depending who your sheriff is and who they've hired to do healthcare services, the chronic conditions that people suffer from sometimes get minimal attention. And a lot of people, I can tell you from our experience, progress in their chronic disease while incarcerated and have preventable complications.
And Evan, Anna Bess Brown just dropped in the Community Clinical Connections resource on the Q&A. So I'll drop that in the chat so everyone has it. And then, so what does that mean for state level policy? What kind of policy should we be advocating for at the state level?
Yes. So we, and actually, Lauren, you guys may be aware of, there's this wonderful person, Lauren Brinkley Rubenstein, who is very interested in these questions. And she actually was at UNC, she's now at Duke. We still love her. I'm at UNC. But it's called the Third City Project. And she calls it that because that's the number of people incarcerated in the US would make up the third largest city. And so Lauren has a lot of data on her website. If you Google Third City Project, where she's trying to do her best to get what she can from jails and prisons to get a view of health stuff. So in North Carolina, what we would really love to have, obviously, is much better reporting on, especially from our jails, on adverse health outcomes. So there should be requirements, like when someone dies in a jail, someone dies in the prison system, we and actually our prison system is much better about this. Our jails, it is really all over the place. So I believe we need advocacy to require reporting about the health conditions that people have, what the outcomes are, and actually what health services. We do surveys to try and get jails to answer this, but we have no statutes in our state that require a certain level of service. So for mental illness in particular, we know that there are incredibly poor, disjointed mental health services, and half the people are there probably because of some mental health related illness. So we could be advocating for statutes that require basic services. So create a floor for what health services look like in our jails and prisons in our state.
Thank you. Darrell, I seen you unmute. Did you have a comment? Sorry, I don't want to cut you off.
No.
Okay.
I agree with everything Evan said.
Awesome. Well, thank y'all. So we've been able to talk a little bit about policies and programs that are happening to help individuals when they're returning home. But what is it that we aren't doing? What kind of policies and programs should we be advocating for in our communities that we're not already doing now to make this return home smoother?
I would probably start with advocating for the Medicaid expansion because, healthcare is a human right. Everybody should have the right to healthcare, and we're one of the few states that still has not, expanded that. And so that would be my thought. And I say that because our health is our wealth. And I've learned from working with Dr. Ashkin, again, when a person returns home, you have so many barriers, getting reacclimated back to society is just one. You got family dynamics, you're dealing with mental health, housing, employment. I even had a person who for 3 weeks couldn't get an ID because we needed an ID to get an ID. What that means is we went to the DMV and he needed a birth certificate and a social security card. Well, he sent off to get his birth certificate, but he needed a picture ID to get his birth certificate. So we basically went back and forth. You needed one to get the other. And finally, I was able to advocate about how ridiculous that was. And now you can use, not just from me, but I did start a petition. And now you can use your prison ID as a form of ID. So those kind of things are the things I think we should be pushing for, things that we take for granted, that we think are easily attainable. For a person who is returning from incarceration, they have that strike on their record, and it follows you through a lot of different arenas, from getting adequate housing, getting employment and such. So I think that that's what we should be aiming for, is trying to fill the gaps on some of the small things that will help a person get on track, like healthcare, like not jumping through hoops to be able to get adequate housing. I think those are the things we should be aiming for.
Yeah, there in many municipalities, it is not a federal requirement, but in many municipalities, public housing, Section 8 housing is not available to people with a felony conviction, which is so punitive. So these are people who are post-release. They're people who are done serving their time. And if their loved ones are in public housing, or they just want to live in public housing, they're not allowed to. And if they move back in with their family could be evicted for having a felon living in their on their premises. And that's up to municipalities. That does not have to be that way. There's also things about food stamps, about SNAP benefits not being available to people with certain drug crimes. So we're punishing them further post-release with food insecurity. And there's probably over 27,000 laws on the books in the US about job discrimination. So, like many types of licensure is not available to someone with a felony conviction. And so, we prevent people from having meaningful work in their lives by having all these barriers to employment. So, and it's one thing to have these ban the box movements, which are a good first step, right? So that means like a number of counties, I think actually Durham has done this, where, you don't have to check, there's no box for that initial application. So your application winds up in the trash can, but you still will get a background check after, if you make it through that first round. And again, the discrimination then for people with histories of incarceration is profound, and many people don't make it to the next step. So we can work with employers and encourage them to really look at their HR policies and be more open. And a matter of fact, studies show that formerly incarcerated people are better employees on many different measures than average employees. And a matter of fact, this also, a lot of reform does not include people with histories of quote unquote violent crime. So, if you listen to the news, when people are advocating, a lot of times people with a quote unquote violent history of a violent crime are excluded from many types of reform. But if you look at the data, post-release, people with actually a history of violent crime are the least likely to commit another crime, the least likely to be reincarcerated. So also we need to be careful about the sound bites and how we're continuing discrimination against people that have been impacted by the criminal legal system.
And we just have a couple notes in the Q&A section regards to Medicaid expansion that it is slated to happen by the end of June. That, of course, is dependent on the passage of a budget.
Yes.
So that's what we're waiting for now, but hopefully that will be less of a challenge for our neighbors in North Carolina after June.
Yeah, although we have failed to have budgets for almost 2 years in the past, right? So I am still, I can't believe it when I see it, that we passed that budget. And then the question is, how are we going to do Medicaid expansion as well? And, we have managed Medicaid in the state, which is not a bad thing in and of itself, but there are still opportunities to sadly discriminate against people with histories of incarceration. And also these, are they going to put things about work, right? A number of states have tied certain employment activities, right, to having benefits. So I still think we need to pay a lot of attention to how that is actually operationalized once it hopefully gets going if we pass a budget.
Well, excuse me, that was all of the questions that I had. Thank you both for all the information and the insight that you have been able to give us. Returning home is definitely a long process, and even after you do your time, it's like you come home to do more time, really, with all the barriers that are put up in place against you. And so I do appreciate the work that both of you are doing in the community to help the return home easier. And hopefully we can see some changes come in the future that'll make this whole process less sticky and stressful. Marianne, I don't know if you have any other questions that you wanted to ask.
No,
but I'll-
no other questions. I wanted to thank you, Evan, thank you, Darrell, and Kashmir, thank you, and Step Up Durham for the work that y'all are doing, and for having this conversation with us.